Hi, today we're going to talk about chest pressure. Now, when I talk about chest pressure, this is under the assumption that you've had your heart checked out, you've had all of your organs. Hi, today we're going to talk about chest pressure and what you can do about it. Now, if you develop pressure in your chest all of a sudden, you should get your heart checked out. You should go to a cardiologist or go to your primary care doctor, have them do some tests just to make sure that you have nothing underlying with your heart or lungs that is going on. Now, let's say you've gotten everything cleared out, you have nothing wrong with your organs, and you still have this pressure. The reason I want to talk about it is I started treating a young man recently who has trouble breathing, shortness of breath, and felt pressure in his chest. He had a full workup, heart came back okay, lungs came back okay, other organs came back okay, blood work came back okay, but he had this trouble. He liked to work out. If you looked at him, he looked great, but the problem was he couldn't catch his breath, and he was under a lot of stress at school and felt that he did well in everything and he was taking care of himself, but he couldn't get rid of this underlying pressure. So he went actually to a place to get his breathing checked out in Denver, Colorado, and they diagnosed him with some type of breathing disorder, and it was a general term that wasn't anything specific, but they had recommended some exercises and he tried them and couldn't really get them to work. So that landed him in my office. Now, when we think about chest pressure, a lot of that can come from the muscles in between our ribs called our intercostals. His sternum position, which you've heard me talk about in some of the other videos, it was too far in front. He had a very broad chest and shoulders and held himself very proudly because he was working out a lot as a young man. We're taught this excessive posture. He was very skinny, and his ribs flared out very greatly at the very end. They just came right out at the very bottom here. And so he had this pressure and he didn't know what was going on. So we started with some breathing exercises, which I have some videos on my website, and if you want to learn more, contact me. But basically we taught him how to breathe differently so that the muscles in between his ribs, his intercostals, relaxed and his sternum was able to drop down, and he learned how to engage his side abdominal muscles to hold his ribs down, so when he inhaled, he used his diaphragm and got air in that filled up his whole trunk. Instead of lifting his chest up to breathe in, instead of blowing his belly out to breathe in, he used his diaphragm by having his ribs down. The diaphragm descended down to create a vacuum of air coming in, and so he stopped having overuse of all of these muscles throughout his chest to get air in and out, and he was able to relax the muscles to allow the chest to expand. So if you're out there, or if you know someone out there who has gotten all of their organs checked out and there's no underlying issues cardiac-wise or pulmonary-wise, but are still having chest pressure, please consider looking at your breathing and your rib cage to see where you might be having muscles that are constricting you. And if you calm that nervous system down, like I've talked about in previous videos, you can improve how the muscles relax, and they allow you to expand your ribs and contract them when needed, but more importantly, you can use your diaphragm to breathe. Thanks for watching. Bye.